combination of approaches which include media to educate and entertain, a cloud-based electronic medical record with AI and genetics and microbiome and family history, medical history, social history, and then feedback devices in the way of these devices which are integrated, we can give you a healthcare system in your pocket which is aligned with your needs. Finally, the last part of it is to align the existing healthcare system so that you can triage and give best-in-class service to every patient. So what would that look for? In the affluent, it would be a concierge medical system. In the middle class, a subscription model. And in the less fortunate, a foundation CSR model. But the end result is we would train our AIs with so much data that we would be able to predict who will get into trouble where, and hopefully give them a path on which to live, and also see where they'll fall off in real time. Sort of like in a car, you have a dashboard which shows you your speed, your battery, your gas, everything. I can do that in real time for you, as well as at the same time making health fun. And we call ourselves lifestyle architects, not healthcare innovators, because health is a very small part of your lifestyle. But what you discover is no amount of wealth will make up for health. You can be the wealthiest person in the room, but if you don't have your health, it's not worth anything. And the flip side is also true, that if I can get my friends and family to me, with me on this journey to 100 years, and I call all the people in India and the world my family and friends, then what we'll do is create a longevity solution which is independent of governments, independent of all of the other common separations that we suffer from. It doesn't matter if you're a man or a woman. It doesn't matter what color, creed, sex. It doesn't matter. The point is we take care of each other together. And so that's our goal, that how do we take this out, make it very, very cutting edge. And the idea is it's a platform so that we're integrating all of the best-in-class players to work together to build a universe of superheroes, each with their own subsets of skills, complementary to the rest, and making sure that our biggest shareholder is our patient. And if that's done and we align the practice of medicine with the patient always, and we're the patient's guardian from cradle to grave, all of a sudden the world looks better. And imagine our life expectancy in India is reported to be 69 to 71. In the West, it's about 78 to 80, depending on which country you see. Now the question is, what's the happiness quotient? They talk about Bhutan and all these places. I want India to be the happiest place. And from India, we lead for the world. And so I think if we can build this in India, because we have such a young population to work with, and we have people who are well educated and very hardworking, we can take this on a planetary scale, and we can do it at a very low cost multiple, because India is small unit economics with a high volume scaler. So the type of information we'll glean from that on how to cure diabetes, how to cure heart disease, how to do things will be world class for the rest of everyone else. But we'll lead from here.